Hello and welcome to part 4 of our 8-part Advancing Healthy Aging webinar series. I would like to let everyone know that this webinar is being recorded in both English and Spanish. And with that being said, the series is designed with you in mind to provide valuable insights and tools that can empower you to navigate age-related conversations and support healthy aging within your local community. This is an exciting milestone today as we've reached over 100 people registered across 5 states for this webinar. So thank you all for sharing your valuable time with us. Our team would also like to thank the USDA, excuse me, Rural Health and Safety Education Grant, which has made this series possible. Part of our grant is to collect data and feedback on this series. So at the end of the webinar and in a follow-up email, we'll share a link to an optional quick evaluation survey in both English and Spanish. Our team very much appreciates your participation in the survey. Your data will be kept confidential and be used to inform future programming and other healthy aging initiatives for CSU Extension. Lastly, the chat is open throughout the presentation, and this will be an interactive webinar, so please feel free to engage with our presenter. We will also have a question and answer session after the presentation. With that, I would like to introduce you to Colorado State University professor and CSU Extension champion, Dr. Allison Brothers. Dr. Brothers is an associate professor and lifespan developmental scientist who focuses her research on the promotion of healthy aging throughout the lifespan. Her areas of interest include attitudes towards aging and awareness of age-related change, and the influence of attitudes towards aging on health, well-being, and health behaviors. Dr. Brothers is also the faculty advisor for the CSU Gerontology Club, connecting students with applied learning opportunities at CSU and around their communities. Dr. Brothers, we're excited to hear what you have for us, so take it away.
Well, thanks so much. And thanks everyone for being here. This is one of my favorite things to talk about. So let's get going. I'm going to start with a little bit of researchy terminology, theory, background. Hopefully it's not too much, but I think it'll get us all set on the same foundation. And then we'll have a little bit more interaction after that. We'll be talking about how age stereotypes and views on aging are linked to health and longevity. What can we do and some action steps. And I've got some questions for further discussion. So before we jump in too much, by way of introduction, as Ginger said, I'm a faculty member in Human Development and Family Studies. I'm on the teaching faculty, and I'm in my 9th year. So if you're not familiar with our discipline, with our department, it's the study of humans in context and across time. So I'm trained as a psychologist, a developmental psychologist, and a gerontologist, meaning that I study psychological aspects of adult development and aging. And I teach mostly undergraduate courses, a little bit of graduate classes as well, 4 at a time per semester. And I teach on topics of aging, mental health, and physical health throughout adulthood, risk and resilience across the whole lifespan, and more. And I love working with my undergrads. I'm passionate about getting them connected to real world experiences. So in that way, I consider myself an engaged scholar, and my work is rooted in science, but I'm committed to bringing that scientific knowledge to the community, also listening to what the community needs are to drive new research programs. And my published research focuses around views on aging and how they shape health and well-being and longevity. And I collaborate internationally with people doing this work as well. I co-developed a questionnaire called the Awareness of Age-Related Change Scale, ARC, with Dr. Manfred Deal, and many of you may know him, Professor Emeritus in our department. I've published 30 peer-reviewed papers and given more than 50 conference presentations, but all this is just to say that my research, my teaching, and my passion for getting important knowledge out there all comes together in this talk. So I'm really grateful to be here, and hope you may take something useful, regardless of whether you have an extensive background on this topic or whether it's kind of newer for you to start thinking about today. Oh, and that's the Gerontology Club there at the Alzheimer's Walk and at Market Days in the downtown farmers market at Larimer County. So let's begin with a little terminology. Views on aging is a broad term that describes the way that we think about age and aging. And I'd like to break that into 2 distinctions. So one, we have other views, which are like age stereotypes, how we think about aging in general, older people, those separate from us. And these views may be known to us, or more oftentimes are implicit or unconscious. On the other hand, we also have specific thoughts about our own aging and our own aging experience. We refer to this as self-perceptions of aging. And we know from research that the stereotypes, kind of those general expectations of aging, shape our self perceptions of aging and influence how we interpret our own aging process. So that makes sense, right? We're products of our environment, our society, and the messages that we've gotten since we were really, really young creep into our unconscious beliefs and shape our thoughts, whether we know it or not. A little background on just a stereotype in general. We have stereotypes about all different types of groups, right? Gender stereotypes, racial stereotypes. Age stereotypes receive a little bit less attention, but follow the same kind of principles. So they reflect socially shared beliefs about a group. Um, Things that we attribute to all people that we think are in a certain group, how they act, who they are. And the key is that they tend to be very exaggerated beliefs, right? Maybe they were developed from a kernel of truth, but the problem is with stereotypes is that they're exaggerated and applied to everyone that we think might be in a particular category. So nobody wants to admit they hold stereotypes, but I can assure you we all do, whether we want to or not. Our brains use these frameworks or schemas as cognitive shortcuts to quickly make sense of the world. And they're usually subconscious ways of just like shortcuts of thinking about things. And that's where the danger comes in. So the best thing we can do is to become aware of the stereotypes that we may hold because it takes conscious effort to override those subconscious processes. And we know the way that we think directly impacts the way we behave. So, for instance, if someone holds a stereotype that older people are frail or helpless, right? These terrible just ideas that you might apply to a whole group of people, it changes how they're interacted with. So imagine if a police officer or a store clerk or a hiring manager had those attitudes, they'd have real impacts on the way that they interact with people. So we want to become aware of our thoughts and assumptions, check them with the facts, and revise them to make sure that our attitudes, our stereotypes, don't turn into behaviors, which is discrimination. The two parties involved, not a fun kind of party though, the two kind of parties involved in a stereotype are the perceiver, who's making a judgment about a target. But one of the most fascinating things to me about the study of aging and age stereotypes is that if we're lucky enough, we will eventually become the target of our own stereotypes about aging. So just because people may reach a golden age of 50, 75, 100, it's not like they're automatically deprogrammed to stop thinking negatively about aging. Those negative thoughts can turn against ourselves as we get older, and that becomes detrimental. So let's keep that in mind. A little bit more, a couple more theory slides. Is everyone with me? Hopefully, this is okay. Um, One way to study stereotypes and some of the work that has been done is called the stereotype content model by Cuddy and Fisk, and this was back in '06 that this paper was published. It's not the nicest depiction. Bear with me because I think it's still important. So the stereotype content model can apply to any group, and it basically says, if you can see on this grid, it's kind of categorizing people into four different categories. And so it basically says that when we stereotype people, we're making quick judgments about how competent they are and how warm they are. Right. And so, what tends to happen with older adults being stereotyped is that people tend to stereotype them as lower in competence and higher in warmth. And what does that do? So, that puts them in this category here where the star is. That means that even if people have good intentions, they often may treat them with pity. And that is not helpful, correct? So this has been described as doddering but dear, right? Like, oh, when people say, oh, this older person was so cute, right? I kind of cringe because I understand that it takes the power of the competence away from them. So that's kind of one of the, not so pleasant messages about stereotypes and showing a way that how people think actually impacts the way that they might interact with somebody, and that's not helpful. So a lot of this is to kind of bring these conscious thoughts into awareness. And so, can how we think about aging have actual consequences for health? And I'll tell you, absolutely it can and does. And I just want to give you a few examples from the research. So, a lot of the work on this topic was pioneered by Dr. Becca Levy, a psychologist at Yale, and she's accumulated decades of research connecting views on aging with harmful outcomes related to health and well being. So this graph is from a 2009 paper, but I think it has a really drastic story. It's kind of one of those oldie but goodie papers that I think is just really poignant. And there's many, many, many more of these. So this is just one example. But from the Baltimore longitudinal study, people in their midlife years were asked about their thoughts on aging. So is aging better or worse than you thought? Do things keep getting worse as you get older? That type of a thing, kind of like a dichotomous scale. Very simple scale, super powerful in predicting actual outcomes. And so over the next 38 years after these people were surveyed, people who held more negative views on aging were significantly more likely to have a heart attack, stroke, or other cardiovascular event. So how we think about aging in midlife actually has direct implications on our health 20, 30, 40 years later. And I'll just show you a few snippets of, and happy to connect you with more of the research on this. I've got a few references at the end, but not all of these are on here. But similar style of research and from different countries, different researchers, different methodological approaches, views on aging and more negative views on aging have been linked to poorer memory, worse handwriting, which is a subconscious indicator of health, which is kind of really interesting. Engagement in fewer health behaviors, slower walking speed, poorer mental health, a higher stress response, or actual cardiovascular response. And then you may have, if you're familiar with this area, you've probably heard this before, fewer birthdays. So on average, people who think that that aging is all negative and downhill without kind of seeing the positive aspects of aging tend to die 7.5 years earlier. So that's the number that's been, and that was actually from Dr. Levy's research. So it's been substantiated and is pretty shocking. How could this be, right? Understanding the how and the why, from all of her empirical work, she went on then to develop the stereotype embodiment theory as a way to try to explain pathways, like what's happening here. And you may be thinking of certain explanations as I talk. You probably have some ideas that you're thinking about already. So see if they match up with what the stereotype embodiment theory says. So this theory really says that we internalize age stereotypes across the lifespan. There's been research that shows that kids as young as 3 have negative age stereotypes. And if you think about, we'll talk about more examples in a little bit, but if you think about old fairy tales, right? Though there's a wicked witch or, these very kind of stereotyped older characters sometimes that kind of start to be told in the stories. And the problem is that when people start to identify as being older themselves, then they start to direct those stereotypes inward. So this is a self-stereotyping process. And then their negative expectations and beliefs about aging impact their own health and functioning, interestingly. And this has been shown to happen through 3 different pathways. So still part of the same theory. It could be a psychological impact so that our expectations, what we think should happen with aging, becomes a self-fulfilling prophecy, right? I think that aging means sitting in a rocking chair or recliner or not being active, or I think aging means having pain all the time. And so then these things kind of start to, you attribute more of those things that you notice, and it kind of becomes a self-fulfilling prophecy. There's also evidence that this happens through behavioral pathway. So when we have more positive attitudes towards aging, we tend to engage in more healthy behaviors. And that's been shown from an empirical standpoint as well. So people who have more positive expectations may be going to the doctor more often, eating more fruits and vegetables, getting those steps in. That kind of thing. And then also physiological. So I mentioned before the cardiovascular stress response. And so lab exposure to positive age stereotypes actually shows a reduced cardiovascular stress response. So there's definitely some physiological data going on there too. So kind of interesting to think about all these ways. And there's probably more, and we don't right now. This kind of next wave of research is looking at the hows and the whys and the mechanisms and in what situations. Now that we know these links are pretty robust. So what can we do? How do we get past that rocking chair stereotype, right? And so I'd like to just share a couple of practical strategies to help people notice and interrupt pathways and effects of these wildly pervasive and sometimes very sneaky stereotypes that we don't always notice. This is where we can get more interactive if you're up for it. Action step 1, notice and question. That is going to be, I hope we leave here going, notice and question, notice and question, notice and question, right? And we're going to talk about 3 different common places where we tend to see pretty negative age stereotypes. I mean, hopefully I won't be able to be doing this lecture in like 10 years or 20 years or something like that. But I will tell you right now, ageism is alive and well. It is out there. And there's a lot of things that are happening to combat it as well. So I think we're kind of seeing a lot of the discrepancy in the conversation happening, but there's plenty of negative portrayals of aging out there. So let's talk about the media. I am admittedly not great at keeping up with movies and never knowing actors' names, but it's still would be appreciative if you can think of maybe the last movie or show or something that you watched and type it in the chat if you want to. And maybe just say if were there older adults shown negatively or positively or kind of like realistically, or were they maybe not even present? And so let's talk about that. We know this is older research by now, but I'll kind of show you a progression of some more recent stuff too. But Donlin and colleagues in 2005 showed that older adults who watched more TV, like more daily TV viewing hours, held more negative age stereotypes. So we know that the media is one way that traditionally negative age stereotypes have been spread. And one of those reasons is because older characters are likely to be shown in a very stereotypical way or omitted altogether from movies. And there's a really interesting study that analyzed movies in the 80s and 90s and early 2000s. And they found that only 7% of characters were played by older adults. They just weren't even there. Right, totally omitted. But if they were there, then more than half were portrayed in a stereotypical way. So they had this very narrow, right? They were like the wicked witch or the grumpy old man or the senile neighbor, or, something that was like didn't have much complexity. We know that negative age stereotypes are rampant on social media. And that when we see negative media messages, such as in COVID times, and news sources were spreading, some pretty negative ageist views without probably intending to, but kind of like, oh, if you're 65 and older, you're at high risk. Well, there's plenty of 65-year-olds and older who are much better health than some 20-year-olds, right? So it's not only chronological age. There's a lot more complexity to it that was totally getting mixed. And so what Levy was able to show in a more recent paper was that when older adults were seeing these messages that primed them for negative age stereotypes, that it really had some poor mental health outcomes. So, what TV and movie examples can you think of? Are there any that you'd like to pop in the chat and give an example of? I've got the easiest classic one here. Grumpy old men, right? Kind of. I think in the movie maybe there is some more complexity as you get to know the characters, but certainly the title is pretty ageist.
Allie,
Well, yeah.
Oh, we do have one that somebody just said, and I don't know this one, but Man on the Inside is a new series with Ted Danson where he is portrayed mostly positively. He's the protagonist.
Excellent. Thanks for sharing that. Great. And I have the chat bar up here, but I'm not seeing anything pop up into it. So yeah, feel free to let me know. And if other people are thinking of things, feel free to keep them going in there, or maybe for discussion after. Oh, someone raised their hand. Would you like to say something? And
It
Rose.
looks like our chat is not working, but if you can add them into the Q&A, it looks like that one is working. I apologize for that.
Okay, gotcha. Okay.
Okay, here we go. Here's another movie, The Visit, about a couple who are sundowning. Let's see, and there's another one, Blue Bloods, and Matlock are other examples people have provided.
Yeah, great. Did anyone want to say any more of their examples about whether they're positive or negative or realistic portrayals? No problem. Why don't we keep going, and you may think of more. So along the lines of my notice and question action step, um, maybe you could also be thinking about what shows and movies now include older adults and also show them in more complex roles. And there's been a little bit more attention. Older actors are having an award season moment and finally celebrating older women. There do seem to be a lot more opportunities and roles that actors and actresses have access to now that are perhaps more complex and more interesting and less stereotypical. So next time you watch a movie, just notice and question, what do you see? And hopefully we'll see some progress in this area too. There's a lot of fun ones to talk about. I don't know if these shows are shows that anyone has watched, but one way to help break down age stereotypes about people in other age groups is to allow them to interact. And so one thing I'm always telling my students about is, 55 plus communities have some really great benefits and seem attractive to some people. But one thing that they do is that they artificially separate people of different ages. And there's lots of other mechanisms in our current society, right, where people really are only interacting with people of their own age. And that could be kind of dangerous. So I'm always asking my students, do you have any friends who are a different age than you? It's so important. We can learn from each other. We can question our own stereotypes. It's harder to stereotype against an entire generation if you know an individual, right? And I tell my students too, I'm like, there's pretty negative age stereotypes about you all, right? The age stereotypes, it goes both ways. It goes to lots of different generations. And the harm comes when certainly that maybe there have been some cultural or socio-historical events that happen that shape how people are living and showing up in the world. But is it fair to apply them to every single person? And so when you know more people of different generations, it's harder to actually apply those stereotypes. But these are two shows that I've noticed recently. So we've got Reservation Dogs here on the top. And Only Murders in the Building, where there actually seem to be like friendships developing between people of different ages. So it's not just that older people are present, but it's like there's these like meaningful relationships where they're, maybe making fun of each other in a way that friends do. And so I've seen that start to happen in the last several years or so. All right, so we've talked about media. Let's move on to healthcare. Bad news for you, but even healthcare professionals can hold ageist beliefs. And there's a lot of nuance here, and there's a lot of incredible providers out there. But this is a place where people tend to report that they've experienced ageism. And so I think it's just important to be on the out and be prepared to advocate for yourself. So I'll pose this question out there. Like, why do you think people who are working in healthcare may have even higher rates of negative age stereotypes than the general public? It might be surprising. There was some older research that showed those links, but there's kind of two main reasons. So one is that they may be only treating the sickest people, and then they may make assumptions and draw conclusions about what it means to be an older patient versus a younger patient. But they may not come into contact as much with a vibrant, strong, independent 95-year-old. And so what they're thinking about what it means to be older perhaps gets skewed over time about, once they're just treating the sickest people. And then medical schools currently don't have a requirement in geriatric training unless you go into geriatrics. And so it's only for specialists, and there's so few geriatricians that people who in many different practices don't have to have any training in any aspect of gerontology or geriatrics, which is a little bit scary because we're not preparing professionals for the chance to notice and question their own stereotypes, and it can have negative impacts on the way that they interact with patients. So there's a lot of attention being done in this area, but just as a kind of PSA, I would just say notice and question, make sure you're comfortable with your providers. You may sometimes encounter a provider that you don't have a choice over, right? In a hospitalization, somebody may come and interact with you, and you may notice problems there. And so I think just kind of the notice and question, then also be prepared to advocate for yourself. There's a neat little 3-minute video I'm not going to show, but I've got the link in the extra resources, and I'll just kind of give you the rundown. But you've heard about the one about the knee, right? Someone says, "Hey doc, my knee's killing me." And the doc says, "Well, it's 75 years old. yeah, but my other knee's the same age, right? So there's too much. It's too easy to just attribute pain or ailments to aging, and when people do that, there's research that shows that those age attributions of healthcare complaints, then they're not as likely to go get treated. So if you have pain in a knee when you're 75, you might be less likely to get it treated than if you have pain in your knee when you're 35, just because if you attribute it to aging, and that can be pretty dangerous as well. So this little clip is called "They Said What," and it's I think it's all women, but they're all describing situations when they encountered ageist beliefs from their doctors or other healthcare providers. And so this Kathy here gives an example. She was telling her doctor about her back pain, and his response, he actually literally said to her, "Well, you're no spring chicken." So she felt compelled to share that. There's, I think, maybe 5 or 6 people featured, but another person remarks that when her mom had a fall at her house and they went to the ER together, the nurse actually said out loud, "Why do I always fall right when I'm ready to ready to go on break?" And so, these messages they're showing up, and certainly I don't want to say that, everyone or even the majority of people have them, but they're out there. And I think it's important to be on the watch and be ready to advocate for yourself. There's research that shows that people get overtreated and undertreated, and so different situations, but because of age. Right? So, it used to be that clinical trials would exclude people who were 75 and older, like maybe for no good reason, just for convenience, or not intentionally try to include people. And so then there's not as much evidence or no evidence about how that medication works in people who are older than that. So that's been a problem that is receiving some attention and getting some correction, but certainly is an ongoing problem. Or there may be overtreatment, right? It might be that once you're in a hospital situation, they're just kind of trying to throw everything out at you because you're older, and it may or may not be appropriate. So when age is the only deciding factor, that's when it's a problem. So we need much more nuanced conversations with physicians and healthcare providers. And again, there's many, many incredible and caring healthcare providers out there. So just make sure you can find one and shop around if you feel like you are not being, your experiences are not being validated. Right. Let's see. Another thing that happens in the healthcare setting, often also in long-term care settings, is elder speak. And you may have heard of this term, but certainly you've probably seen this played out in real life. And I just bring this up here because it can be more common in the healthcare setting. It's just a simplified way of speaking, honey or dear or let's do this and let's do that. It can be thought of as baby talk. And the interesting thing about elder speak, there's been a lot more research coming out about this. But intentions are usually kind and caring. Like, people are usually well-intentioned if they're talking to someone in this way. It comes from an area of care and concern. However, what we find is that it's driven by ageist views and can have some harms. So usually it's, talking down to someone because, we assume they have some functional needs or can't hear or can't understand. And maybe they, have recently been running an entire business or country, right? We have nothing like our recent election to bring out all the ageist conversation and public discourse, right? But can't assume that everyone who is a certain age has functional needs, and the harms come in because what this recent meta-analysis was showing was that even though it's well-intentioned and people kind of try to use elder speak strategically to maybe like, let's go take your bath now, kind of rather than like you would just talk to someone of any age, like it's time to, time to use a shower, your time in the shower is available now or whatever. It's People use it because they think it'll be helpful, but it actually, this study was finding that it doesn't improve language comprehension. So talking down to someone or simplifying language or using really, really short sentences doesn't help. And especially when exaggerated prosody and higher pitch were involved. So that, the tones going up and down. Slower speech can help if needed, if there's hearing problems or some cognitive impairments, but the gains and benefits disappear if someone's using those high pitch or the sing-song kind of voice. It also can trigger stereotype threat. And so what that means is that if someone's talking to me like I'm old and helpless, well, then I must be. And so then there's kind of that priming of a stereotype, and people can kind of think, well, I guess I do belong in that group, right? Kind of just takes the power all away from them. The study also showed that it can increase resistant behaviors. Oh, people don't like it. People don't like to be talked to like they're a child, right? But it can also increase resistant behaviors. So especially among people who are living with dementia, maybe they don't have the communication strategies themselves to be like, don't talk to me like that. But what it may result in, how it shows up is resistant behaviors, fighting, withdrawing, crying, silence, kind of like the behaviors that get someone labeled difficult. And so checking how we speak to people can really be a help with that. Let's see. And so one thing that a really neat tie here though is a 2015 paper concluded, and I'm just going to read you the conclusion from this paper. So in support of, the study and findings, older adults with better attitudes towards aging and more positive personal intergenerational interactions, right? Everything we're talking about today, seem to be protected from the harmful effects of patronizing communication or comprehension during intergenerational interactions. So it kind of seems like these, have more positive views of aging, more interactions with people of different ages, can kind of equip people with a protective factor to not be as harmfully impacted by people who may be using elder speak against them. All right, we did media, we did healthcare. How about birthday cards? What do humorous messages say about aging? Be honest, have you sent or received cards like this recently? I debated whether to even show these. They're pretty terrible, but these are clear examples that ageism is out there, it's rampant, and it's still considered funny in the general public. Like, this is one of the isms that's still socially acceptable, and people still make fun of older adults. And so I'm hoping the next time I give this talk, that's changing. And I think it is changing a little bit, but you can't buy these cards about other groups of people, right? That would be the brunt of a joke. And let me ask, like, what stereotypes, menopause cards, somebody said I hate menopause cards. Yeah. So what stereotypes do these things perpetuate, right? These messages, right? They say aging is bad, mobility problems are expected. There's incontinence cards I didn't even put on here. Frailty equates frailty with aging. And so then there's that double whammy of ableism and ageism together, which is, I think, will be important to uncouple from the general public, perceptions of aging. All right. So are there better birthday cards? Let's notice and question, right? We're still in the notice and question action step. Maybe there's a better way to celebrate the number of years on a planet, and it really should be a celebration. So changing the narrative. I don't know if anyone from the organization is on here, but one of my favorite nonprofits out of Denver. We're so proud to claim them. This is a nonprofit whose goal is to eradicate ageism. And they launched a birthday card campaign where artists can submit better cards. Notice and question, find that better truth. And that speaks to the kind of aging that you want to see. So check out their website if you're in need of some better birthday cards. All right, let's move on to our action step 2, extending kind of what we've already been talking about. We talked about notice and question, notice and question, notice and question. Now let's take it a step further and talk about intentionally noticing what gets better, right? So like a fine wine, right? Research documents tons of benefits, and some things actually do improve with age. So if you need to keep these in your back pocket, there is, and sorry I didn't put all the references in here, but I'm happy to connect you with anything, or even like adult development and aging textbook. But research evidence for age-related improvements occur in lots of different domains. And so emotion regulation tends to get better as we get older. There's an enhanced tendency to be able, or a capacity to be able to experience multiple emotions at once and kind of recover from negative emotion. Coping skills and capacity for resilience tend to increase with age. Sense of identity and self becomes stronger. Crystallized intelligence, knowledge, vocabulary, the types of things, like the information that we learn over a lifetime stays with us. Fluid intelligence does decline a bit, right? We get our reaction time gets a little slower, short-term memory maybe get a little slower, but just because there's so many things in the depths of the libraries of our mind, right? That takes a minute to get to it. But crystallized intelligence is one thing that does improve. And there's some really neat studies about wisdom and creativity coming out. And I saw a cool one recently about patents and the average age of people who create patents, and it gets, increasingly higher as people get older if they're in that world. Generativity, this is the tendency to want to give back to the next generation. So this could be, there's movements like the graying green, all right, so old activism among older adults for climate change initiatives and things like that. Or generativity can be anything, like establishing a scholarship or mentoring kids in schools or parenting, grandparenting, any of these things, but making things better for the next generation. And engaging in health behaviors. People, once they hit midlife, tend to engage in more health promoting behaviors. So all these things, right, are getting better, but these aren't the things that we're talking about. These aren't the things that we're seeing on birthday cards usually, or that are getting, talked about in shows or out there. And I want to talk a little bit about my own line of research, which has been around this awareness of age-related change. And we're talking about, with this, we've developed a questionnaire, but did a ton of focus groups and several different studies trying to look at the empirical side of things, realizing that people have different self-perceptions of aging in different domains, right? So how I think about my own aging might be different in the health domain than it is in the work domain or the family domain. And we can have, this sounds so obvious, yet it's so important, that people they can and do hold both negative and positive views simultaneously, right? The two things are true. Yeah, maybe I do have some more aches and pains, but I've gotten so much better at, maintaining positive social relationships or something like that, right? We have gains and losses. And so often the discussion about aging is just on the losses. And so with this questionnaire that we developed, we're asking people to notice what's getting better, what's getting worse. And we are seeing that people are reporting gains across the entire adult years, and also losses, of course. But also finding, as we're getting into some of the more advanced statistical analyses of these research data, one finding recently colleagues reported was that older adults in long-term care who had more positive views on aging, they'd higher ARC gains on their questionnaire. They saw this as a buffering effect. So even if they also had some negative health problems going on, holding positive views of aging were protective, and the impacts of the negative changes really weren't quite as strong. And so the important pitch I want to make here is that there's no denying that aging comes with plenty of challenges and losses, right? It's no joke. And I'm not trying to sit here and tell you today, like, oh, you should just think positively and everything will be fine. I don't think that's helpful. I don't think it's true. And the trick to flipping the script on aging really is, it's not toxic positivity. That's not what we're saying. Instead, it's like this more balanced and complex view of aging. So it's easy to focus on just the losses because of all of these stereotypes we've been talking about. But if we can also look for gains, then that seems to have this really powerful buffering effect. So don't ignore the challenges and the problems. It's important to notice them and problem solve and cope and adapt to those with those coping skills that get better over time. But in addition, the research suggests that we should really look for the positive aspects of aging. So I would ask you, what's better now than when you were younger? And you can probably list a lot of things, right? But that's not usually how the conversation about aging goes. And so this comes into the awareness of age-related gains. Like, let's notice and question and think about what's gotten better compared to when you were younger. So I'll leave that out there for personal thought. We don't have to get into that today, or if anyone wanted to bring any of that up in the chat, that is totally fine. along with that, one of the last things that I'll kind of end with is just who are your aging role models, right? There's kind of more and more attention of what can aging look like, and if you think about what type of a role model would you want to be for others, or do you look up to you? What stereotypes? I love this one. What stereotypes would you like to defy? Right. So what stereotypes about older people are out there? Like people are set in their ways, or they don't want to learn new things, or they never, try out new music, or you know, I don't know, aren't open to new experiences. Like maybe you're like, "Ah, that's not going to be me. I'm going to do something a little bit differently." And there's some social media influencers. If you use social media at all, there's some interesting influencers out there that you can check out. So just a few questions to kind of guide discussion later, or your own personal thought as you reflect on some of the stuff. So you recap things here. I guess to sum it all up, I would say that stereotypes are exaggerated beliefs that are applied widely to a group without consideration, and they can have real and important effects on health and well-being if they go unquestioned. They are everywhere. And by noticing and questioning them, bringing them into conscious attention, we can interrupt these harmful pathways and effects that we know are out there. Be on the watch for elder speak, which even if it comes from a place of care, it also reflects bias and can be harmful. And watch out for those age-related gains that can help protect against any losses you may be experiencing as well. That wraps it up for me. I've got some discussion questions, but I'd love to hear what questions are popping into your mind after hearing all that. I'm also happy to chat more if you have questions or want more resources. I've got a few of the research-based research references here, and I think Ginger's going to provide handouts for everyone. And then just a few ideas of books, websites, videos. These are just a couple of the ones that I really enjoy and recommend. So, all right. Well, maybe I'll go back to this slide here, and we can open it up for questions, Ginger.
Great. Thank you so much, Dr. Brothers. Before we get going on question and answers, I'm going to just pop the evaluation in English and Spanish into the chat. You'll also get those in your email afterwards in a pop-up while everyone's thinking about the questions. All right, here we go. First one, we've got, what is the organization that produces positive cards?
Oh, that was Changing the Narrative. And I think Ginger has already placed that link in the chat.
Yep, you've got it. I can put it back in there again in case somebody missed it. I know it doesn't
They
always
have a
save.
nice email newsletter as well that is you can subscribe to and hear all the great advocacy work that they're doing.
They also do some presentations. I think you can, if you're with an organization, I think you can work with them to present individually, and they do them, periodically, publicly as well too. So let me see if we have some Q&A questions from the beginning. Oh, here we go. What is the difference, if any, shown in research among different cultural and ethnic groups' views on aging?
Yeah, it's a great question. So we've got our questionnaire, and some similar ones have been translated into close to 15 to 20 languages by now. So some of that international data is coming out. A lot of times people think that that people in more Eastern countries have more positive views on aging. And there's mixed research on that. There's been some comparative studies across international um, groups, and there are some cultures that positive views on aging you would think would maybe be even higher or more prevalent, and what it seems to be is that they may become even more negative once there's major physical decline, like in certain cultures, kind of like an expectation that people like disappear, or after they're no longer able to physically kind of contribute to society. So there's a lot out there. There's so many qualifications that it's hard to answer on that. But certainly, let me just tell you about one of my favorite studies across 26 countries across the world, that the countries that tended to have the most positive views on aging were countries that had people working at higher ages. and volunteering at higher. So the countries with higher workforce involvement and volunteer involvement of people of older ages, the entire nation actually had more positive views on aging. And the assumption is because people are just exposed to people who are older and are contributing. And so I think that's a really cool message, that sometimes these societal things really depend on the structures that we have and opportunities that we have.
Absolutely. Rose Powell mentioned the blue zones are very interesting.
Yeah, absolutely. There's been a little bit more recent controversy. I think probably just in response that there's now a Netflix documentary about the blue zones. And some people are there. I think there's pretty much like one researcher who's like, oh, the methods they never substantiated birth dates. And, so there's a little bit more controversy, but a blue zone there's been about 5 zones in the world that have been identified that people have a higher tendency to live to 100 or beyond. And so National Geographic has sponsored some research in that. And what the questions have really been is like, well, what is it and why? And could we bring those practices into our lives? And so a lot of it is around social structures and supports and what people are eating and drinking and how much they're moving. And sheep farmers in Sardinia who still walk 6 miles a day because they're working in their 90s, have certainly different health outcomes than the rest of us. But some of those are more transferable to our lives than others.
I might need some clarification on this question, but it says, how did they determine their relationship wasn't the other way around, like those having a harder time with aging? For example, disability, early onset of chronic disease from other negative views on aging.
Yeah, really good question for the methodological. So there's a way to statistically control for all types of things that might possibly explain the relationship. So even after health status, number of chronic conditions, and blood pressure and all these things were controlled for, the attitudes towards aging still remained as a positive predictor statistically.
Thanks, Sally. Any other questions before we wrap up? These are wonderful questions. Oh, here's another one I just saw. How can achieving age-friendly university distinction like CSU has help model the importance of intergenerational connections?
I love that question. I think it's a really important designation. This is an international movement to get universities established as age friendly, and I think there's a few different ways to think about it, right? So we have this distinction because it is an area of interest, and we believe in it pretty strongly, but the designation doesn't mean that we are 100% age friendly and then we've met all the goals, right? It means that we're kind of like prioritizing this and that this is a really important initiative and that there's so much work to do. And so intergenerational relationships is one of those aspects that is part of the plan, and valuable in so many ways. I think can be an asset to our community, but incredibly to our students too. So if anyone's interested I think my Gerontology Club students are wanted to launch an intergenerational book club this semester. So that could be fun, and we're TBD, but if you're interested, feel free to reach out and we'll get you in the planning discussions on that. And there are a lot of good programs and also a lot of good work to be done to develop more.
Awesome. All righty. I haven't seen any other questions come in, but if you have any other questions, please feel free to email me and I can pass them on to Dr. Brothers. You guys will get an email from me, so you'll have my contact information. Reminder to fill out that survey for us. We really, really, really appreciate that. And I just want to thank everybody again for attending. Thank you, Dr. Brothers, for your incredible presentation. I would encourage each of you to be curious about healthy aging related initiatives in your community. Are there some that are going on that you can get involved in and just be part of the conversation? Or maybe this is an opportunity to start some healthy aging initiatives within your community, like age-friendly communities. I would also like to thank Ruth Andrade and the Colorado Language Cooperative for providing interpretation services today in support of our commitment to language justice. And lastly, on the heels of talking a lot about intergenerational connections, I want to remind everybody about our webinar next month, February 20th, 11:30 to 1 p.m. Mountain Standard Times. We will be learning from Colorado State University Healthy Aging faculty, Dr. Christine Fruhoff. Her research interests focus on healthy aging families, including youth and grandparents raising grandchildren. She'll discuss the power of intergenerational and multi-generational relationships and what we can do to strengthen those relationships for our own health, healthy families, and healthy communities. We hope to see you next month and have a great day.